What's up, you guys? My name is Miguel, fellow X-ray tech here, giving you a daily dose of radiation. Today's video we're covering how to deal with patients who can't / won't or unable to lift their head out of the infamous chest X-rays that we be doing in the hospital. So, depending, I would say, on the situation, you have a few options. If it's a baby, you're going to have to either you let up and you're going to have to kind of hold the little baby's noggin still, or kind of make some noise like up here, up top, to kind of have them like look up. There's that way for little babies, for little men or gals. Usually, if you're really busy, just let up and just kind of just take over the situation. It would always, it's not the safest, but if you're really busy, I've noticed certain parents are more hesitant. Now, me as a fellow X-ray tech, and I take my kids to be doing their procedures and stuff like that. I already know the business. I just be manhandling my kids, so I make sure that we don't be struggling at all while we get our exams. They're little kids. Other parents are different since they're not in the medical field. Let's see. Certain patients, let's say they are special needs or they're contracted, you have two scenarios. You can do a regular, you'll like place the board like a regular chest, and majority of the time you'll kind of clip the top, but you'll have the bottom. What you can do, two situations. Either, depending on if like their head's just like leaning down or it's contracted. Will kind of depend. If it's just kind of like down, but you can kind of move it, you could slightly lean back the bed and have gravity help you and kind of shoot it like that. Other way is kind of raise the board a good amount, depending on how like their head is down. You may have to raise the board up a good amount behind them, so it'll be like kind of like up here, maybe at like extreme conditions, and then you'll have to kind of angle the tube up to be able to get the apices better. There's that situation. Sometimes certain patients, I would say like an ICU or other like places where you can't really like lean their head back because maybe they've had like some kind of surgery or like something like that. You may have to just kind of let up and just slightly lean their head back or kind of elevate and do a little bit, because you can't completely, because like maybe they have a seat collar, maybe they have stuff like that going on. What else we have? Sometimes the patients, especially us as night shift techs, majority of the time the patients are kind of like asleep or not exactly in with it, so you may have to kind of like, it's hard because like sometimes on certain floors you'll think the patient is not exactly, like they'll have what's called propofol, which kind of puts them to sleep, so they're kind of like knocked out. So like you'll try to like you'll talk to the patient, and since it's like 2 in the morning, they'll be like passed out, and you just see the bottle of propofol, so you just kind of assume that they're asleep or like just knocked out completely. And you'll like go into like, of course you'll like talk to them. You're like, hey, we're gonna do this, da 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 da, and they don't respond. So sometimes I'll like repeat myself a little bit more louder, and then they don't. You may have to kind of like tilt their head back, and sometimes some patients like at that point you feel like by you touching them, they'll kind of like respond, and then they'll kind of do their like help you or understand. What other ones do we have? If they're like in the trauma bed, you could do the same thing as far as like if like their head is tilted down, and you just kind of pull the board up, but you're angling, because like with the trauma bed, like since there is a good space SID or OID, I guess, in between, you may have to like angle the tube. Like you may have to move the board a little bit more, because like you're already gonna be thrown off. Like I've noticed, like even if it's like perfect straight on, there's like a slight, like it slightly moves up a little bit. So like if their like head's completely down, maybe they're contracted or something like that, you may have to like increase the more angle even more and move the board even more. It's just something, it all kind of depends on your trauma beds that you have going on. And yeah, it's been your boy Miguel. See you on the next one.